Hi, Miss Loganathan.
Hi, Mr. Anand. How are you?
Good, good. How are you doing?
Excellent, excellent. Did you draft those questions, Anand?
Oh, I did.
They
Yes.
were very well written.
Thank you,
Thank
thank
you.
you. So before we get started, I just wanted to say thank you again for allowing me to interview you.
Okay, you're
Um,
welcome.
so let's get to it. So, first question: what is it like to work for USAID?
Working for USAID it's been excellent.
Mm,
Gave me a great opportunity to understand how high level policy work is implemented. You
mm,
get to influence a whole range of stakeholders at very high levels, from
mm.
the Secretary of State to ambassadors to ministers of health.
Wow.
You get to influence how money gets used in different countries. We work in over 100 countries around the world.
Hmm.
And we are in the forefront of addressing major public health threats, such as the Ebola situation that we were in about a year ago,
Hmm.
and now Zika. Um, so we are always in the forefront of addressing major public health problems, and we are there to help people.
Wow, wow. And you are based in Afghanistan and Pakistan, is that correct?
No, no, I'm based in Washington, D.C. I cover Afghanistan and Pakistan, so I travel back and forth
Oh, I
from
see. I see.
Washington, D.C.
So, how did you begin your career in public health?
I began my career because my father, uh, Mr. Loganathan, suggested that I consider public health because he met several people at the bank who were doing public health.
Oh, okay.
So after college, I took a year off and I worked at a hospital in India, in Chennai,
Mm,
in Madras. And then after I liked that experience, I ended up applying for a master's in public health at Tulane.
mm.
And then after getting the degree, I started working in public health.
Wow. So, as a senior health officer, what are some of your main responsibilities and duties?
My primary responsibility is to represent both the Afghanistan and Pakistan mission
Mm,
at Congress. So I go to the Hill, Capitol Hill,
yeah.
meet with all the congressmen and make sure we get all the sufficient money that we need to run our programs, defend the programs, answer all questions,
Mm,
and help them understand what we are doing and help us be accountable for the work that we are doing. But we get monies from the taxpayer through the Congress, right?
mm.
And so basically that's what we did. That's one of the key responsibilities. I go to hearings at Congress and defend the portfolio.
Mm.
I also meet with ministers of health and other ambassadors to help them with any work that they're doing on Afghanistan and Pakistan. I help them address any questions and
Yeah.
take them to big meetings.
Mm.
I also work with the mission at the embassy to help run programs. So those are my three core responsibilities.
Oh, I see. I see. So, what are some examples of some key health issues or healthcare system issues found in Afghanistan and Pakistan?
So there are two countries in the world that still have polio.
Mm.
Polio has been eradicated in all the other countries except in Afghanistan and in Pakistan.
Oh, okay.
And so we are at the last mile, and we are there along with Bill and Melinda Gates,
Mm.
the Rotary, the Ministry of Health, and the UN, and the private sector in helping eradicate polio in Afghanistan and Pakistan.
Mm.
Until there is no cases of polio, so the whole goal is to completely eradicate polio from the
Yeah.
world.
Mm.
So with these two countries, it's still if the polio virus is still circulating, that means it can still contaminate other countries. So we are the last two countries that are still has polio virus circulating. So we are working with them, with the Ministry of Health, in eradicating that. So hopefully in a year or two we should eradicate.
Oh, I see.
And then there are major maternal and child health challenges. So we are working with the ministry to reduce maternal mortality, that is deaths faced by mothers, and child mortalities, and infant mortalities. So all the challenges related to that we are addressing with the ministry.
Oh, all right. And are there certain key government officials that you have to interact with while in Afghanistan and Pakistan?
Yeah, I interact with the Minister of Health, the Deputy Minister, and all the directorates.
All right. So in 2013, you were a key panelist at a discussion about gender and health in Afghanistan held at the Woodrow Wilson Center. Now, what was that experience like for you, and what did you take away from it?
So I was the primary, I represented the U.S. government. I was the sole panelist from the U.S. government. And then right next to me was the Minister of Health from Afghanistan, and also several other leading experts. So I had the wonderful opportunity to talk about what the U.S. government was doing in terms of health. And the minister acknowledged all the support that we had provided and acknowledged the work that I was doing. So that was really nice.
Wow.
And that experience was very eye-opening in the sense that it put the work that I was doing at a high-level platform. And I got to, it was a conversation with high-level people in a public setting. So it was a very exciting opportunity for me to be televised, and then they wrote articles on the work that we did and the panel sessions too. So it was very good.
Wow, that's amazing. And it was about gender and health. So did this involve like the maternal care that you were talking about? And
Yes, very much. Very much.
I see.
Yeah, because one of the things that we are doing in order to provide maternal health services is we need to have appropriate healthcare providers. That means ensuring there are female providers there. And in countries like Afghanistan and Pakistan, where there are huge gender discrimination, it is tough to get hold of qualified and educated women to work in these settings. So we have programs to empower these women to be able to provide health services in both public and private settings.
I see. So, what are some of the things you do when traveling to Afghanistan or Pakistan?
So when I travel, you mean in terms of the type of work I do?
Yeah, like when you actually go to the country, yeah.
So when I go to the country, I check in with the mission. They'll have a list of things that I would need to do for them. In addition to that, I will be meeting with the ministry staff to talk about our portfolio, any actions that we would need to take to resolve any matters. I will be going there to attend events. I'll be going there to present papers. I'll be going there to meet with the private sector to help them invite them to work with us on delivering healthcare services.
Oh, all right. And in your personal opinion, how big of a role does USAID play in maintaining global public health?
USAID is one of the largest donors in the global public health arena. We not only provide a large amount of financial contribution, but we also technically leading a lot of the discussions. So we are one of the biggest players in health.
Wow. And what are a few other players you would say in
World Bank? Then you have the Canadian donor, similar to USAID. They're called CEDA, and you have the British. They're called DFID. Then you have the European Union, EU,
Mhm.
who's there. Then you have Bill and Melinda Gates Foundation.
Yeah.
And then you also have all the UN organizations. So UNICEF, World Food Program, UNDP.
Mhm.
Who are the other ones? Yeah, so those are the key ones who are there.
Wow. So what qualities do you need in order to be a successful health officer for USAID?
First thing you need to have is you need to be a strong diplomat. You need to be
Mhm.
able to diplomatically talk and convince and negotiate with people.
Mhm.
You need to be approachable. You need to communicate verbally and in a written manner very well.
Mhm.
You need to be aware of the cultural sensitivities because you're working in so many different countries and all the countries have different rules and protocols
Yeah.
and cultural practice. So you need to be very well versed and understand about that.
Mhm.
You also need to be very good technically in what you do. And then the last thing is you need to be a very good manager. You need to manage not only your work well, but also manage different personalities and the politics well.
So you really have to be able to fill in that leadership role to.
Yes.
I see.
Yes.
Mm-hmm. So, since you have a history in programming, how has that helped you as a public health professional?
What do you mean, a history in programming?
I saw that online. It said that you were very into the public health scene, but you also did a few things in programming, such as building teams together. And has that helped you?
Of course, you got, as I mentioned, that's part of management, right? So you need to know how to program activities, develop new programs, and run programs. That is all part of being able to effectively manage projects, people, and different clients' needs.
I see. And last question, what has been your most memorable experience while working for USAID?
Just the opportunity to meet some of the most impressive individuals in the world.
Yeah.
And get to work on projects that have huge impacts in saving people's lives and improving people's lives.
Wow. Well, that's amazing, Miss Loganathan. Thank you so much.
Thank you, Anand. Do you have any other questions for me?
I think that's it. You have a great rest of your day.
Okay, thanks.
All right, bye.
Okay.